So I did just want to note before we get started that this recording or this presentation will be recorded and will be posted on our website after. If you don't consent to being recorded, please drop off the meeting at this time. Okay, great. We'll go ahead and get started. Welcome, everyone. I hope you all are doing well and having a good Tuesday. I will go ahead and put my screen up right now. And can everybody see the main presentation slide? Great. Okay. Well, as I said, welcome. Thank you for joining us for this webinar, Drumming Up Interest for PHICCS II. My name is Nina Martin, and I am a program manager with our Department of Public Health Policy and Programs at the National Indian Health Board. Before we go ahead and get started, I just wanted to let everyone know, as I mentioned, that this meeting will be recorded, posted on our website for later use for folks who are unable to attend today. This is a small group, so less concerned, but just please keep yourself on mute to avoid any background interference unless speaking. And feel free to place questions in the chat box, raise your hand. We are a small enough group that if you have a question as we go, please just feel free to stop and unmute yourself and ask, or pop it in the chat box and we'll make sure that we answer them periodically throughout. Today's presentation is going to be part of a review and highlights from our first PHICCS project, and we'll go into a little bit about what PHICCS is just in a moment, and then an overview of our plans and preparation for the second PHICCS II that will be happening over the next year or two. And really, we wanted to have everyone here today to have a discussion about how we can improve the PHICCS process. One second, let me just change the setting. So before we begin, just a little bit about the National Indian Health Board for anybody who may be unfamiliar with the organization. We are an organization that was created almost 50 years ago by the tribes to emphasize and advocate for improved health and well-being for American Indian and Alaska Native tribes. Our team that you may have seen emails from, received communications with, etc., is a small but mighty team, including myself, two program coordinators, Munez and Jessica, Carrie Joseph, and Tyler Dougherty, all within our public health policy and programs team. We also will be welcoming a survey design consultant who will be helping us with the second part of PHICCS II to make sure that the survey and scan and all processes are as smooth as possible. So moving into the first part of our presentation, we wanted to give a little bit of background about PHICCS I. I've said this a number of times without introducing it, so I just wanted to make sure that we cover what PHICCS is. PHICCS stands for the Public Health in Indian Country Capacity Scan. And this is a periodic scan to assess tribal public health infrastructure, capacity, needs, and priorities. It is a tool and a project that is informed by tribes and our tribal partners, and is designed to have a national scope to understand the broad needs for tribal public health as a whole. So why does PHICCS exist? Kind of going back, there are a number of players in tribal public health, moving from the federal government, services provided through federal agencies such as the Indian Health Service, moving through national organizations, regional health boards, state and local health departments, down to the services and activities provided by tribes themselves. We know that there are a number of profiles on state, territorial, city and county public health activities, but there is less information known about the needs specific for tribal public health. The National Indian Health Board first hosted an initial scan in 2010, so over 10 years ago, exploring the needs and priorities for public health capacity for tribes and for Indian country. Since then, that moved us into our PHICCS I project, the first iteration of the PHICCS scan. That started in 2015, culminating in a final report that was released in September 2020. I'm not going to go into too much detail about PHICCS I. We do have plenty of information on our website. We have our full report, and we have a number of webinars that are more specific on the details of PHICCS I. So today is just a highlight, but if you have any questions about PHICCS I, please feel free to ask them. We're also happy to point you to any resources that we have around that. Today will just be kind of the high-level overview and key highlights. So what we know from the PHICCS I project is that we had 134 respondents to the initial scan. All 12 IHS service areas were represented, and about 90% of the respondents represented federally recognized tribes, 9% represented tribal health consortia. About half reported they were self-governance compacting tribes, and roughly under a half noted that they were self-determination contracting tribes. The final report that was released in September 2020 is our 2019 PHICCS final report. This is available on our website, which I will show you on our website later. We'll pop a link into the chat as well to make sure that you have access to this. It is a very detailed, very informative document that is meant to ultimately support and guide essential public health work in Indian country. The report, we hope, is helpful to strengthen efforts to educate a variety of audiences, including legislators, federal agencies, policymakers, and others on the needs and opportunities to strengthen and build tribal public health capacity. The report has 3 key focus areas and I guess 4 general purposes, really to highlight the needs, priorities, and opportunities to support and strengthen tribal public health infrastructure and the systems needed to deliver those services, as well as serve as a baseline to measure progress over time. We did want to note some limitations and challenges of the report are just in general, as with all projects, things took a little longer than we thought, which led to some challenges posed by federal government shutdowns over 2019 and in the middle of the data collection period, as well as a response rate. Some of these questions are questions that we have for the group today to help us figure out how we can perhaps increase response rates, make the scan easier to complete, and address any questions about the scan and some of the challenges that we faced. Going back to PHICCS I, this is all in the report, so we'll go over this somewhat quickly. The report is focused on 5 key areas, mirroring the areas in the scan, focusing on public health authority, key services and activities, assessment, performance improvement, and accreditation activities, public health workforce needs and areas for development and opportunities, and then ultimately priorities and needs as defined by tribal respondents. You'll find information in the report about most often occurring public health activities, and this is just a snapshot of some of the most frequently reported occurring ones. You'll also find information about the provision of public health activities and the entities that provide that. I love this graph as one of our primary ones because you can see that tribal health organizations and tribes are ultimately the main provider of public health activities in their service areas. You can also find information in the report about workforce, including average funded filled positions, positions that need to be filled and remain unfilled, as well as areas for development for the workforce that were identified by respondents, including things such as technical assistance on specific areas, trainings, specific trainings that are needed, as well as other key issues for developing and maintaining a robust tribal public health workforce. There is also information on public health priorities as defined by the respondents. We asked what they thought were their top 3 organizational priorities, and we heard key things such as data and assessment, health education, health promotion, policy development, and planning. Finally, we also asked about public health needs, including what can the CDC, other federal agencies, states, what can they do, and what additional resources are needed. So you can get a snapshot from the respondents who completed the scan of what some key areas were where there are opportunities to invest and build. The report was released first publicly in September 2020, and since then, this is the link to the report on our website, which we'll pull up in a little bit. We've also done a number of presentations at conferences, including at our 2020 National Tribal Health Conference, over 1,000 hard copy mailings to tribes, tribal health directors, member organizations, and key partners, as well as regular communications through our newsletters and through our partners. We wanted to note that the PHICCS report is instrumental to the work that NIHB does to support public health and general public health and wellness in Indian country, including through education awareness raising around tribal public health infrastructure, working with our Congressional Relations and Policy Center to make sure that there's appropriate education and awareness for congressional members and other agency staff, as well as looking at other ways in which the information in the PHICCS report may compare to other key surveys. Finally, before we move to the next section, I just wanted to note for any folks who are on the call who may have participated in PHICCS I that the data you submitted is yours. And NIHB very much wants to make sure that we return your individual data to you. We have a secure process for this, so if you are interested in requesting your own data back, please don't hesitate to contact me. My information is here, as well as any of our staff members on the call today, and we'll help you get that set up. So moving on to the next section, evaluating PHICCS I. This came from a desire really for us as we go. We knew that we wanted to make sure that we're doing this scan in a way that is useful and helpful to tribes. So part of what was built into the first PHICCS scan was an independent process evaluation by the NORC, the University of Chicago. This was a qualitative assessment really intended to guide future data collection efforts for either any future PHICCS scans, such as the one we're preparing for now, or others. And it was a survey of both 14 respondents and 5 non-respondents, including information about outreach, engagement, the questionnaire itself, the report, and ultimately recommendations for future data collection. We did hear from some of the interviewees who participated in that evaluation that they anticipated using the PHICCS information and the PHICCS report for key activities such as writing grants, benchmarking their own performance, developing programs, advocating for funding, and preparing for accreditation, including public health accreditation activities. And importantly, too, we heard from participants that the value of PHICCS to tribal public health was that it helps contribute to the public health evidence base and ultimately increasing visibility of tribal public health departments and all of the amazing work that they do. So before I move into planning for PHICCS II, I wanted to stop and see if there were any questions about the first PHICCS or any of those processes that you may have heard of, may have been engaged in over the last 5 years or so. I will check the chat too to see if there are any questions. Feel free to unmute yourself too if you have any questions about PHICCS I. Okay. So moving on to PHICCS II. The second scan, PHICCS II, as we refer to it in short, will take place between 2021 and 2023. So we're in the initial stages of preparing for this second scan. We hope to use the initial scan topics and tools that we used for PHICCS I, but improve them and modify them to make sure, again, that we address some of the challenges that occurred in PHICCS I, that we make sure that the scan for this new second PHICCS is timely and relevant. You know, we are aware that there have been substantial changes since data was collected in 2018 and 2019 to when the scan is expected to launch in early 2022. For example, the COVID-19 pandemic, we know, has changed a lot of the ways in which tribes deliver and conceive of public health services and activities. So we want to make sure that we capture that. And the goal of PHICCS II is really to add again to that evidence base and help us describe changes in tribal public health infrastructure capacity, needs, and priorities over time. This graphic gives you a little bit of insight into where we are in the whole PHICCS timeline. So right now we are in the middle of phase 1, planning and instrument development. We hope that to launch the scan in early 2022, at which point we'll move through data collection, data analysis, And then in mid-2023, hopefully be wrapping up and preparing the final report and distributing that to our partners. And I'm going to show all of this on our website, but we did want to note that one of the things that we really want to get your feedback on today are these 13 recommendations. And these recommendations are on our website, and they're based in part on the NORC evaluation, the process evaluation with both respondents and non-respondents, feedback from our partners, and then internal reflection. The goal of these recommendations, which span all 4 phases from planning and instrument development all the way through report utilization and dissemination, is really to hear and think about all of the ways in which we can improve these processes, make sure that they're inclusive, and make sure that they are ultimately grounded in the needs of the tribes that PHICCS is serving. To do this, in part, we have 2 open comment surveys, and you may have seen some advertisements around this, perhaps in the same email where you saw the link to register for this webinar. But we really want to have an open period and hear from everybody who is interested in PHICCS and who will use PHICCS to share information on, one, how can NIHB implement those 13 recommendations? Really, how can NIHB improve across the span of PHICCS from start to finish? And then a more detailed second survey on how can NIHB improve the PHICCS tool itself. And you can click on these links. They'll take you to start the survey. They should take no more than 10 minutes or so, depending on the level of detail that you want to provide in feedback. But they're meant to be kind of higher level, open-ended questions for you to be able to share your thoughts, comments on how we can improve PHICCS as a whole. These both surveys will close on Friday, October 29th, so just under 2 weeks. But we hope that you are able to complete them, share some feedback if you do not want to share it here today, or if there are thoughts that you have afterwards. I did want to note that they are anonymous, so we won't be collecting any identifying information, solely for NIHB to help improve and hear from you. So before I stop there, I wanted to share the PHICCS website, make sure that I connect all my dots and show you everything, all the good information that we have. So if you go to the National Indian Health Board webpage, or if you click the link that we provided in this presentation, you'll come to our PHICCS project page with a little bit of information about what is PHICCS. You'll see here a link for frequently asked questions. And so these frequently asked questions are based off of some common questions that we got in the development of the first PHICCS, 2015 to 2020. And then some questions that we received throughout the process that we wanted to make sure we answered in advance of PHICCS II. Again, some more detail explaining what PHICCS is, the goal of the PHICCS project, and really how does PHICCS benefit tribes, tribal organizations, the ways in which this information can be used, again, to help tribes in their internal processes and benchmarking for public health services, public health systems, delivery and capacity strengthening, increasing the visibility of, again, all of that work that tribes do to promote and protect the health of their communities. Some information about hopefully why we've heard it's important from tribes to complete the survey. Again, really adding to that, that knowledge that we have of what those needs are and making sure that the needs of your tribes are heard. What types of questions does the survey ask and who should complete the survey? We did want to note that from previous experience with PHICCS I, we found that generally the most appropriate person to fill the survey out would be the tribal health, public health director, or tribal administrator. If you have any questions as you start to think more about PHICCS II and as we start to send more out, please don't hesitate to contact any of our group. The PHICCS scan, based on PHICCS I, we know that it takes an average of about 50 minutes. We are, again, as I mentioned earlier, working with a survey design consultant. We're hoping to be able to streamline some of the things and the ways that questions are asked to hopefully lower this a little bit, make it a little faster and easier for everyone to complete, and make it a little more user-friendly. So those are some changes that we are hoping to implement and that we would love to hear your thoughts about. if there are surveys that you have seen previously or taken that are similar to PHICCS, or that you just thought worked really well. We're always open to hearing those suggestions. And then some information about how we report the data. The key thing to note again is that tribes own the data they submit to PHICCS, and that the report will be presented in a way that is not individually identifying. Again, the goal is for this to be a national level perspective. If you have any questions, of course, please contact me. Going back to the web page, again, here's that timeline that we shared. Links to the 2 scans are on the left side, the 2 surveys. So again, providing feedback on the tool, you click here. And then recommendations for those 13 comments and recommendations for how NIHB can implement those 13 recommendations to improve the overall PHICCS process. You can find more information about PHICCS as well as the 13 recommendations here, which I won't go through all 13 of them, but please, we encourage you to read through. We hope, and if there are recommendations that we are missing, we also encourage you to let us know. Finally, background about PHICCS, the original 2010 report on that initial exploratory scan, and then the full 2019 PHICCS report, as well as the tool. So if you click here, it'll take you, it'll take you to the full report, which you can read through digitally. We also have hard copies available, so please let us know. Going back, that is about everything that we wanted to cover for PHICCS II. I went over a lot. I wanted to pause for a second and make sure that there weren't any questions, comments about PHICCS II, or we hear from the group. Any questions about PHICCS II, our plans? Anything you want me to repeat? Okay, hearing no questions, we can now move into, oh, I see a question in the chat. Oh, great. Thank you, Martha. We appreciate receiving comments through our open comment period. And if there are any things I'd like to move into group discussion, we are a small enough group that folks, if you just want to unmute or if you prefer to put questions in the chat, we'd love to hear your feedback on any of the questions that you may have seen in the open comment surveys, as well as the questions that we have for this group today. You know, if you participated in PHICCS I, or if you saw it, if you've gone through the tool, what did you like about PHICCS I? What did you think worked really well? And conversely, what would you like to see changed from PHICCS I and make sure that we really incorporate into PHICCS II? For example, what topics have occurred between 2018, 2019, and 2022 that we want to make sure that we capture that are essential for understanding tribal public health infrastructure, capacity, services. And then the third question that we have is, how can NIHB improve PHICCS II and more broadly the PHICCS project to best serve the needs of tribes? So I will stop there. And I want to see if anybody has questions. Feel free to unmute yourself. Any immediate reactions to the PHICCS I or PHICCS II plans?
Hi, Nina and everybody. This is Martha from Eastern Band of Cherokee Indians. I think it was really helpful to get PHICCS I was really helpful to get an idea across Indian country of how people are doing things, and helped us talk about our internal practices and what we might improve. I just hope that you get a really good response rate for PHICCS II. because that's key to its success. So whatever you can do to improve the response rate.
Absolutely. Thank you for that, Martha. I mean, I could turn the question to the group too. What are some strategies maybe you have used in your own work or that you've seen employed that really help get kind of response rates for longer scans? That is one thing we heard through the NORC evaluation and through informal feedback, is that the scan is a little long. So again, we're looking at ways that we can be efficient about how we ask questions, who we ask questions to. But as Muna's just put in the chat, if anybody has suggestions for how we can increase the response rate, make it easier, make it more streamlined, we'd love to hear that. And Carrie brings up an excellent question. We know that COVID has had an impact across all of the ways in which we do our work and participate in our lives. And so we're curious if in your own work, public health infrastructure related or not, how has COVID changed how people are participating in surveys in general compared to maybe pre-pandemic? Or I guess what strategies maybe have you seen used or that you all have used in your own work that have been helpful for getting responses, getting detail? How about, that is a very good question. What motivates folks to complete PHICCS? What would be kind of too much to participate in? How can we better ask questions about infrastructure? Or are there things that we're missing or should be asked differently to really get to what PHICCS is covering? Go ahead and stop sharing my screen too. Okay, incentivizing submission, direct outreach tribe by tribe, offering assistance in completing it. That's really helpful. I know initially I believe for PHICCS I, we did do direct outreach and we're interested in trying to explore other ways of doing outreach to advertise PHICCS II. We've considered doing promotional videos to make sure that by the time the scan is launched in 2022, everybody's excited and knows about it and has seen lots of promotion for it. Are there things you have done in your own work or that you've seen done that help kind of get folks excited about a scan that's coming? Or what type of incentives that you have seen have worked really well? Or things that can get folks really interested in something like PHICCS? Are there, like, what would be, another question too could be, what are, the optimal ways that people may want to take PHICCS? It's currently existing as an online survey. But if there are other ways that that could be structured, if there are ways to break it up, if there are ways to promote the digital survey, if we do that format, we'd love to hear about that too. Maybe strategies that y'all have used for, not even something the length of PHICCS, but just smaller surveys as well, or on different topics. Thank you so much, Martha. We appreciate you joining us today.
Hey, David, are you the David Wharton from Choctaw Nation?
May have stepped away.
Oh, I haven't seen or talked to him in well over a year, so it's good to see him on this call.
For sure.
And if you're trying to talk, David, you're on mute.
On the phone, you may need to hit *6.
Mr. Wharton, so are you there? We can't hear you if you're talking. You might need to press *6 on the phone if you've called in, or click unmute on your Zoom window.
May have also stepped away, at which point we can make sure to follow up with Mr. Wharton afterwards. But I think beyond that, it looks like a number of folks have had to leave early. So we might just wrap this up now. So I'm going to go ahead and stop the recording.